Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
beta blockers and angina. Okay, beta blockers are actually these are the first line drugs. These are first line drugs. Mainly they will decrease the symptoms of the disease, and these beta blockers will also improve the exercise tolerance in the patients also. Okay, in the patients with in chronic stable angina or in patients with stable angina, it improves the exercise tolerance also. These beta blockers will also treat the stable angina. Okay, they will actually decrease the exertional heart rate, and thus it will decrease the exertional heart rate, and it causes myocardial contractility, and thus it causes reduction in myocardial oxygen demand. Okay, thus it is used to treat the stable angina, number one. Next, because it is decreasing the exertional heart rate, it is also decreasing the myocardial contractility, and thus it is decreasing the myocardial oxygen demand, and thus it is used in the treatment of the stable angina. Then second, if you see the one more important thing, right? So this is angina and the beta blockers.
thank you and thank you for watching.